Thank you so much, Yvonne. So my name is Mary Jo Dudley. I'm the director of the Cornell Farmworker program, and a faculty member in the Department of Global Development at Cornell University. I'm also on the board of directors of Finger Lakes Community Health, and I'm the co-chair of the Farmworkers subcommittee. And with me today is Yissette Rivas. She oversees all the farmworker health components of Finger Lakes Community Health. And we're here today because we really wanted to share a little bit. We learned a lot, and we thought that there's some things that we learned that would be useful for the larger community. We welcome your questions. We left plenty of time for questions. We will take them at the end just so that we don't interrupt each other. I'm going to be sharing my screen. Okay, just checking. The screen is up, right?
No. Joe. So we still can't see your screen. Okay, now it's going.
Okay.
Perfect.
So as I mentioned, we're really interested in sharing what we learned as collaborators in the COVID, as a COVID response collaborator. I'm going to start with a little bit of background. The Cornell Farmworker program is pretty unique. It was actually started as a result of student activism, that there be a program at Cornell specifically to address the needs of farm workers and their families through research, education, and extension. And because this is the central focus of our program, it became really important that we find a mechanism to support farm workers throughout the COVID crisis. And we found that this kind of partnership, ongoing collaboration, was a way that we could work hand in hand and learn from each other. As part of our program, we typically are in contact with farm workers to understand what these needs are. So during the COVID crisis, we took some steps that aren't necessarily what we always do, because these were things that farm workers were identifying as their priorities. And over time, priorities among farm workers change, but common areas of support are immigration and legal support, where we link farm workers with pro bono immigration and family law attorneys. We do workshops, which we typically would do on farms in families' homes, Know Your Rights workshops about immigration rights. And a significant component of our work has to do with helping families where the parents may be undocumented, but they have US-born children, to complete emergency planning documents in advance. These documents include naming a temporary guardian, which is the choice of the parent, power of attorney, and once a guardian is named, if a parent may be in danger of being deported to their home country, they can complete a form that allows their temporary guardian to take their child across international borders. That's what's called the parental permission to travel. We also help farm workers who are interested in completing a healthcare proxy. Another area of our work is in the workplace. Many farm workers identify the workplace as being a critical arena for support. And this effort, it focuses on problem-solving sessions between employers and co-workers. And for those farm workers that are not eligible for migrant ed, we have students who are trained as tutors. Pre-COVID, they would go to the farm worker's home during their day off and do a tutoring session in English. During COVID, we changed this to a virtual tutoring session. I'll turn it over to you, Yissette.
Wonderful, thank you, Mary Jo. So a little background on Finger Lakes Community Health. We started working with the migrant seasonal farm workers in about 1989 in collaboration with a couple counties in our region. About 1995, we became a voucher site to provide case management services to this specific population. And then between 1997 and 2007, we became a separate entity to continue to provide those services. Pretty cool thing, around 2007, we applied and received funding for a new access point as a federally qualified health center. This allowed us to bring in our services to other people in the community as well. So our mission, Finger Lakes Community Health, strives to ensure high quality comprehensive healthcare in communities we serve with an emphasis on underserved and special populations. Our vision is to be the provider of choice for comprehensive healthcare and an advocate for services that improve the quality of life for diverse and underserved populations. Next slide. So who are we? So Finger Lakes Community Health has about 9 sites. Within those sites on the right-hand side, we offer medical, dental, nutrition, telehealth, behavioral health, care management, family planning, insurance enrollment, transportation, and patient navigation and interpretation services, amongst all the million other things in between. We also have an agricultural program that provides direct services to about 22 counties. And that could be in the form of going to some of the work sites, some of the farms, and providing direct services there. We have an immunization program. I'll talk a little bit more about that as we talk more about some of these slides. And then we have a voucher program that's serving about 42 counties. So the voucher program is designed to help migratory and seasonal agricultural workers who are uninsured get medical, dental, and specialty services outside of our Finger Lakes Community Health sites. So this would be a payer of last resort, but this program allows patients to receive services at a discounted rate, and in some cases, pay for the services completely. One thing to note about services or about our patient population, is that 64% of the patients we serve, the population we serve, speak another language outside of English. So their native language is not English. And just a little funny slide here. You can go to the next slide, that's fine. Perfect. So this slide here, just funny little slide to depict all the services that kind of one patient has to navigate through. If you look at the look on the patient's face as they're sitting there scared, I think this is something that a lot of our patients and clients can attest to. It's pretty scary to try and navigate all the different healthcare providers, all these different systems, and can be a little overwhelming. So while we pride ourselves at Finger Lakes Community Health as being a one-stop shop, it's important to be able to navigate that one-stop shop and know the services that we have. So our patient navigators, our community health workers, and our case managers, they do a really great job at walking patients through this. And I just think it's really important to depict kind of how scary it could be, but that these individuals are partners in this navigation. Next slide.
So as we started under COVID, there were many challenges that were experienced among the farm workers and were communicated with our program. Initially, we tried to address the challenges with the lack of information and misinformation. Of course, because of the stay-at-home mandates, we had limited access to farm workers. We could not go to farms as we typically do, face-to-face. And the farm workers expressed this fear of government agencies. They hadn't really dealt with Department of Health and government agencies who were coming to the farm. And this created a lot of fear in terms of how that would interact with their immigration status. A significant portion of the farm workers here in New York State are undocumented. So they do everything they can to avoid interacting with government agencies, but they found themselves in a position where their employer was saying, you must tell the full story if a Department of Health representative comes to the farms. There is a lot of fear among the farm workers, and I should say that how we learned a lot of this is that we had an emergency fund, and so farm workers that tested positive for COVID-19 who wanted to access the emergency fund would reach out. We would have a phone call just to make sure we had their information correct. And a lot of people among the farm workers were very afraid that because they were unable to work, that they would be dismissed, they would lose their job. During the early phases, there was a lot of social media, which said that was really highlighting COVID as a phenomena that was brought in by immigrants. And when we saw a higher incidence of COVID positive cases within the farm worker community, there was a lot of social media about it being an immigrant illness, and not really taking into account that the living and working conditions of farm workers made social distancing extremely difficult. Because many farm workers live in communal housing, social distancing is challenging, but also farm workers continue to work despite the stay-at-home mandate that was in the state, because they were essential workers. And so some of the other things that people talked about were the social, the geographic, the linguistic isolation. And in New York State, the Department of Ag and Markets and the Department of Labor issued state guidance for farm safety, but there was no additional funding to make sure that would happen. So the regulations for cleaning between shifts were very specific, and that became another task that farm workers were expected to assume. So while the pandemic offered a wide range of challenges, the expertise of Finger Lakes Community Health, who has worked with the farm worker community for many years, with our expertise as the Cornell Farmworker program, who has had close interactions with the farm workers for many years, allowed for new conversations and new collaborations to address the barriers I just mentioned, as well as to find creative solutions to support farm workers. So initially we started with information sharing, information about COVID itself and how to protect oneself against COVID. We had to do a major transformation in how we did our work. Since I mentioned many of our efforts were face-to-face on farm, we had to convert our interactions into virtual interactions. Fortunately, we had 3,000 farm workers that were in our network, for whom we had their personal cell phone numbers, so we were able to enter them into a text messaging system to find out if they wanted information. We also spent time setting up phone calls, and in particular, a series of phone calls with Dr. Jose Canario, with Yissette, about the virus itself. And the format for the phone calls were a Q&A. And the medical providers, Dr. Canario and Yissette, are trusted by the farm workers. So this was not just a call with a medical provider, but a call with someone who they already knew and had a relationship with. We also worked together, the farm worker program with Finger Lakes Community Health, to make sure that farm workers had access to documents for patients on COVID symptoms, how and when to contact their providers. And through the phone calls, farm workers could text in advance questions that they wanted us to address. These questions were shared with Dr. Canario in advance so he could organize responses. Initially, we sent short videos on COVID in Spanish, Mam, and other indigenous languages, and these were shared via text messages and WhatsApp, 3 to 5 minute videos. And when we first started with distributing face masks, we had a group of volunteers who helped to sew face masks. Face mask was a new thing, and so we wanted to include something in the face mask that indicated how one could wash, how they should wear their mask, how they could dry it. And on the reverse side of this insert, the graphic that you see on the slide, it listed all the numbers of the clinics. This insert is included with all of the 8,000 masks we have distributed to farm workers so that they would get not only a mask, but this direct information. Once we became aware of the kinds of questions that farm workers had, we worked together to develop flyers that had specific guidance and resources for the kinds of questions farm workers were asking. Of course, we used materials prepared by the CDC. Some of that, we distributed that information in relevant languages. And we tried to focus on making sure that this information was distributed electronically as well as physically to farms and where farm workers were. So as we continue to work together to support partners, one of the challenges that arose early on was that those farm workers that tested positive to COVID were in quarantine and were not allowed to leave their homes or their farms to go grocery shopping. The New York State guidance for farm safety wrote in very loose terms, the clinic, the farm, or somebody will provide food to those people who tested positive. And so we started working with a group of volunteers who actually would distribute foods with food pantry list. So we had to put together, we had boxes of dried goods as well as fresh produce. And we also had a farmer who donated beef, and we worked with the local food pantry to put together complete meals that could be distributed on farms. So this, we did weekly food delivery to 100 families a week. But the most important piece was not just to deliver food during quarantine, but to also help them to navigate how they could have ongoing access to food in their community. So these kind of collaborations, the distribution of food and food pantry lists, the development of flyers and educational brochures, co-hosting the webinars with farm workers, were all a critical piece to getting the word out. And we, through our text messaging system, there was also a mechanism for farm workers to request masks, food, medical support, and other supports, so that we could have an ongoing communication using this system. We worked with many community collaborators to make sure that people who texted back that they needed food, that they would be able to get that. If they needed more medical information, that we could link them with a clinic in their area. And if they needed legal support, which became another topic, that we could link them with pro bono immigration and family law attorneys. To make sure that we weren't just relying on the text messaging system, we established weekly calls where workers could call in. And to make sure that also that farm owners and service providers and public health departments would have the same information. We co-hosted webinars with Dr. Canadio in English, and those were widely publicized. And we had many people who attended those. And this was part of an effort to work together to make sure that farm owners were aware of how to request mass testing events for their teams, and testing and tracing and interpretation. And I'll turn it over to Yissette, but really looking at how Finger Lakes Community Health worked together with the Department of Health and with other support groups to make sure that farm workers' needs were really being met.
All right, we're back.
So Yissette, could you give some insights from Finger Lakes, how you experienced this community collaboration as well?
Sure, and I want to talk to a little bit, to tag on to some of the barriers and some of the things that we encountered, the community health worker team in particular. When we talk a little bit about the isolation that this community already experiences pre-COVID, when COVID hit, our access to the farm workers became non-existent. So the farm owners, really made it a point to kind of keep everybody off of their farms for fear of us bringing COVID in, right, wrong, or indifferent. It was just a difficult space for us because we a lot of our work is being able to see patients, being able to see the farm workers, making sure that they're safe, that their environment is safe, and not being able to lay eyes on them was very difficult. I think one of the things that it did allow is for us to reestablish a relationship with the farm owners in a different way. For the past couple of years, at least since I've been with Finger Lakes Community Health, we had direct relationships with the farm workers, and the farm owners would kind of step back and let us, go in and do our checkups and immunizations without too much interaction. But this kind of forced us to have those direct conversations with the farm owners in preparation for even them receiving agricultural workers, right? So a lot of that pre-planning. Another barrier and an experience that I can share, and Mary Jo talked a little bit about it, is early on we had, folks being dismissed from work and being evicted when they tested positive. That was pretty scary because the word travels pretty fast. So then, we had a group of folks who were scared. If they were symptomatic, they didn't want to say anything. They didn't want to get evicted. They didn't want to lose their jobs. And those are the farm workers. And then the farm owners are kind of like, hey, I don't want to have somebody come in and test my group because then that's going to stop everybody from working, especially if they're asymptomatic. So it really presented a lot of challenges in our communication, or even lack thereof, but really engaging folks in a different way and making sure that, we were being a little bit more proactive, and, how could we get information out to individuals who are now scared? We also had to develop a new process with public health. So when we talk about government agencies, our farm worker agriculture community, they didn't want to have interaction with public health. And in one in particular case that always, it makes my stomach turn, we had a patient who tested positive, newborn baby. The only reason why we were able to find out he was positive, he was asymptomatic, was because he had a baby. He had a test to be able to see his child. And then we had public health wanting to put eyes on him every single day. And, he called up our community health worker and said, hey, I have somebody from public health standing outside of my house staring at me. I mean, this is scary, and people are seeing this. So, we had to kind of put a pause and say, how can we, Finger Lakes Community Health, help? How can we be that middle ground, that warm handoff? So instead of a farm worker and agricultural worker hearing from public health for the first time, we wanted to make sure that they heard from Finger Lakes Community Health, a trusted partner in the community, right? To say, hey, you did test positive, and here are next steps. We also talked about different ways to do that kind of eyes on, right? So early on in the pandemic, there was a stipulation that you had to see the person or hear from the person or get their temperature every single day. So we had to come up with another way of doing that. I remember we started downloading WhatsApp onto people's phones and the video, showing them how to do video streams so that a public health representative can see them via video versus having to go to their home. And also for other community members to see that public health was there. So it really, it was good in the sense that we were called upon, right? So Finger Lakes Community Health has grown in their name in that and in the work that they do with this community. So we got those calls from individuals and departments that hadn't worked with this community. So it was good because it expanded our visibility and being able to get to folks, but it was tough when we didn't have that initial conversation. So I think, as far as barriers come and then going to the community collaboration, it did allow us as one of the very few organizations that stayed open, right? So a lot of places shut their doors, they went remote. Finger Lakes Community Health was in a unique position because we do have a pretty robust telehealth program in place. So it allowed us to take things, virtually pretty seamlessly, right? A lot easier than maybe some organizations didn't, which also helped us have those discussions, educate other partners on how they could do that. We also worked very close with Public Health Department and the Department of Health to come up with testing strategies. So aside from doing webinars and doing education sessions, we also, came together to really make sure that specific regions were getting the information that they needed in every single way. So Mary Jo talks about the webinars, the paper pamphlets, there were text messages, just really making sure that we shot information out in every single form because we didn't know how people were going to receive it. We started doing some testing clinics as well with some of the public health departments, and that's continued to be ongoing. But it really, this was the first time, at least in the couple of years that I've been there, that we started to have different conversations. I was on the phone with public health twice a week, every week. And our team in particular was meeting every day to make sure that we were, hearing what was going on with boots on the ground and any challenges that we were facing. So next slide. So Mary Jo talked a little bit about this. We had some amazing partners, many of the partners that are on this webinar and even part of this program that really stood up and said, hey, what do you need? We can't be there. We can't be boots on the ground with you, but what can we provide? And we had masks coming from everywhere. We had hand sanitizer where they could find it, gloves, just a really great effort. People knew that we were engaging the community and they wanted to help in some way, shape, or form. So we had people knitting, sewing them. We had people purchasing them in bulk where they could, sending it to our health centers. We still have ones that we circulate. And this was part of our way to say, even to farm owners, hey, we're not here to do anything that's going to hurt or harm your workers, but let's give you something, right? Let's help. Let's be part of that. And that helped open the doors. Transportation became scarce already in a very difficult region. A lot of those transportation providers, whether it was retired folks, whether it was some of those that are tied to managed care organizations, they had a tough time trying to figure out how they were going to transport. Finger Lakes Community Health, we kept transporting. We put things in place that help keep our staff safe and keep the people we were transporting safe. But we kept the services going because it was necessary. It was needed, especially I would say for our moms. We had a lot of pregnancies, high risk pregnancies, and the world doesn't stop just because a pandemic's there. They're still pregnant and they still need services. So we had to continue to work through this when other people were stopping their services or closing their doors. Interpretation continued. We were doing it remotely as well. So we were, as we always have, just really partnering as much as we can to make sure we're meeting the need. Food delivery. We partnered with Mary Jo and her organization to provide warm meals to individuals. And actually, I had a team member develop a really robust program in which we really just took made a collaborative program around food pantries. So if somebody came in or called and said that they didn't have food because now they were in quarantine and they can't go out and get food, we got food to them that same day, to them and to their family. So I think, being able to react very quickly was kind of our specialty. And I joke with our team that we're best under the most heightened and most difficult situations, but that's the reality of it. We do well under pressure. I don't know if you want to add anything to this one, Mary Jo.
No, I would just say that is certainly the case. And I think the reason why we wanted to call this innovative strategies is because we were always innovating. Okay, how do we address this? But really feeling that there was a partnership and that we could rely on each other. And I think the big piece to this was that the community health workers were crucial because they were able to interact with the farm workers. And that's a really important thing to say. We had other areas of the state where there wasn't even an awareness from the county health departments that there were farm workers in the state or in their county. And I think that because the clinic has that ongoing trust among farm workers, that was the first point of contact.
Very much so. Agreed. Next slide. So what comes next? So as we continue to deal with this pandemic that's not going away anytime soon, there is light at the end of the tunnel, right? We are seeing the vaccines roll out, but we still need to test. We need to test folks who are symptomatic. We need to continue to test asymptomatic, especially folks who are traveling. So that has started in our region as agricultural workers come up, we're testing them. So even they can test out of quarantine. We just started our rapid testing for our farm workers and agricultural workers. And I think that's great because we can get information right then and there instead of sending them to the lab. I mean, there was a point in time where we wouldn't get a test back for 10, 14 days. And that's pretty scary, right? So rapid testing is really crucial and at this time to make sure people have the information that they need. Now, as we move forward to vaccination, I put educate, because I really think it's important that folks have all the information that they need. We're doing printed materials, webinar. My team is out there. They're getting information to everybody because there's a lot of fear. There's a lot of fear in the general community, but there's a lot of fear in some communities that haven't had the exposure to information that we have, information overload. So there's a lot of questions, concerns about the types of vaccines. As an organization, we receive vaccines and we'll take whatever we get. I mean, we don't always know if we're going to get one versus another, but it's important for folks to know that they're all effective and, that they should get their vaccines and what questions that they have, dispelling some of those myths. So my team is going to be going out doing that education. They would also then help register folks. So, it's really going on to our website. It's registering them. It's working with my community health worker team to make sure, that if it's going to be a whole farm, that we have enough people to be able to do so. For those who may be familiar, the actual vials of the vaccine come in doses of 10. So it's important that we don't lose any of our doses. So we have to make sure we have a certain amount of people. It's very intricate because things have to be refrigerated to a certain time. So, the cool thing about it is that we have a very talented group of people. We have nurses, we have providers who are leading this for our agricultural workers. We continue to provide group and individual testing at our sites, and we're doing that for vaccine as well. One of the interesting pieces is, how we're going to do the second round. We have a few vaccines that are out. We have Johnson & Johnson, that's one vaccine, but we also have ones that are 2 rounds, right? So what does that look like for a migrant worker who may be starting their first vaccine in one space and then going to another space or another state? How would they get their second vaccine? So we just have to be aware of those things and how we can mitigate them. And then again, as we've said along the entire presentation, continue with those social supports, case management, medical and other clinical services, and community health workers are out there making sure that they're engaging the population. Anything to add here? I think this is, right before our questions. Do you have anything to add, Mary Jo, as far as what's next for Cornell and how we continue?
Well, I think there's a lot of anxiety about when the vaccine will become available. But there's also been a lot of willingness reaching at farmers reaching out saying, yes, we will host pop-up sites. And actually throughout the process, I feel that the agricultural community, including farmers, has become much more informed about what a community health clinic is about. And I think that's been a great area of learning for our community. And we're keeping in touch with people. We're trying to support people so that they get what they need. And working together has been a really advantageous way to approach it. So we wanted to turn to questions.
Yes, so we do have a question coming in. The question is, what was your most successful method of communication with the workers? WhatsApp, Facebook, text, or Zoom?
We did it all, but I would say from my perspective, it was we had to do it all. We couldn't just do one because we were never able to say that the text message blast reached everybody. But then we also had another arm where somebody was taking a physical pamphlet, putting it in a Ziploc bag and dropping it off at somebody's home. So I would say there's not a one size fits all. As far as effectiveness, we weren't able to gauge what was the most preferred or what's the one that actually got their attention. But shooting out as much information in different forms, I think, is the most effective way to do so.
And for us, we have a whole section of the population that doesn't get text messages but gets WhatsApp. Yep. Zoom is a complicated technology for many of the farm workers. So before our webinars, our Zoom meetings, our virtual legal clinics, one by one, we would help farm workers who were part of that, who wanted to attend that, to upload Zoom on their phone. Many of my students spent endless hours doing this because it's not a technology that people are used to using. But for our legal clinics, we had to have a way to see their face, to see their ID, to be able to complete legal documents. We were under COVID, Governor Cuomo put in a virtual notarization clause so that documents could be notarized using Zoom and FaceTime, but that meant that farm workers had to learn how to do that. I would say that was the least effective, but it had certain purposes for which we had to use that format. And in our system, as I said, we have more than 3,000 farm workers in our text message WhatsApp system, and they indicate which one they want, because many farm workers use WhatsApp so they can communicate with their family at home.
I have a question in regards to the WhatsApp app, and also on the way that you are able to communicate with them. How much information can you really say because of HIPAA, due to HIPAA compliance? In our case, our board of directors, have given us pretty tough restrictions, and I only have a set of generic answers to utilize on our social media platforms. How do you go around that, and what is your recommendation?
So for Finger Lakes Community Health, we do not share any clinical information. So this is just a way to say, hey, there's going to be an information session. Here's the link, join, here's the phone call, or we're going to have an event, a community event. So it's not necessarily to share any type of clinical information. WhatsApp we'll utilize it to kind of, hey, just a reminder, I'm heading to your house to pick you up. That's usually how my community health workers will use it, but it's not a platform that we utilize for anything clinically related.
Okay, but what about when people use it to ask questions related to their that they self-identify as patients?
Correct, but I guess our mechanism that if we send something virtually, it would be through our portal, because that's HIPAA compliant. Outside of that, it really is a discussion that we either bring them back to, but we won't share it, and we have a policy around that because we want to make sure that it's them that's actually there. You just never know with some of these platforms, so we really do have a hard, fast rule that we do not communicate clinical information via WhatsApp.
Mm-hmm. Yeah, that makes sense.
It's tough, though. Agreed.
It is very, very tough.
We do have another question asking, can you describe the transportation Finger Lake provided and what modifications you made for COVID?
Sure. So what we did with COVID, obviously, was masks up. So we had to get masks. We had a nice little kit for our transporters and our community health workers who were transporting patients. What we tried to do is we have vehicles for the organization. So as much as possible, we wanted to use the agency vehicles as opposed to their personal vehicles. And either way, they had a kit that included disinfectant wipes, that included, anything that they can clean their space with. They had masks, and we actually had to put at some point a sign because we had patients who, didn't want to wear masks. Their mask would come down. So we had to reinforce that practice, and we did it through sign. And we actually had to have tough conversations with some of the community health workers that may not have been very comfortable having those difficult conversations. One of the last things that we provided our team with thermometers. Forehead scans. I think, aside from us doing our survey questions, because before they pick anybody up, have you had a fever? Have you been in close contact? Right. So we're doing that for anybody that we're transporting and anybody that's coming to the clinic. But I also wanted to give them another method to be able to scan somebody before they get in the car. And we had a couple that we actually, did present with a fever, even though they said everything was negative on their scan. And, it was a good catch because, a couple of those did end up, coming back positive. So my ultimate goal, especially for me and my role, is to protect my team. Obviously their role is to make sure the patients get the services that they need. But early on, that was my mission. And I stated it in any form I could, is to make sure that my team is protected, because if they weren't, then they wouldn't be able to protect the patients. So that was some of the things we implemented for the transportation piece of it.
Awesome. Does anybody else have any questions at this moment? You can, unmute yourself and ask any questions you would like. Actually, we do have another question coming in. It says, what's the percentage of H2A workers you are serving in your community?
don't know the percentage rate. Mary Jo, do you have an idea of the percentage rate coming in now? I mean, more H2A than not.
More H2A than not, but
Yeah.
so the situation is that the H2A workers come in for a short period of time. I think and statewide, we're talking about maybe a tenth of the population, of the farm worker population. But there's a very intensive time. And I know that one of the things which was, of course, a challenge when H2A workers came is they were immediately tested when they came to New York State, and many tested positive. And so there was a lot of anxiety from our year-round farm worker population that H2A workers would come in and not be practicing what year-round workers had learned to do, would not be wearing masks, would not be social distancing, would come in and be excited and go over to hug another worker. There was a lot of anxiety about that. And I don't know specifically how that impacted the year-round population, but we have H2A workers coming back now, and it's a little different because I think we're more prepared now. Once they arrive, the masks are there, the hand sanitizers are there. And I think another big challenge was how to house farm workers during quarantine.
Yeah.
Because typically farm workers live in shared communal housing, but if you have someone who tests positive, they need to be put in another housing situation. And we saw everything from RVs, hotels, many, many different ways of addressing farm workers' housing needs during quarantine. And I think over the period of time before H2A workers have been arriving now, that there's already a plan in place how to house people. During the early months, farm workers were housed in hotels, and some of the hotel workers became ill, and in fact, some died. And so there was a moment of really trying to understand how can you have workers that never stopped working be safely housed, transported, and given sufficient PPE to keep themselves safe.
Okay, we do have another question. Do you work with your local health department while doing outreach? And if so, in what way do you collaborate, services/referrals?
Sure. So yes, more so now than we had ever done before, to be honest and transparent. So our outreach is done independently, but what we do get, and if anybody needs testing or something comes up, we handle that on our own. What we have started to develop now is if public health gets a referral, or public health finds out of somebody who may need to be, tracked, monitored, outreach to, they reach out to us directly. They have my phone number on speed dial and almost everybody from my team. So what they do essentially is a referral and say, hey, we have a farm worker or farm workers that are developing symptoms, they're symptomatic or they're asymptomatic. Can you guys go check it out? Can you reach out? And we do within a matter of hours, a day at the most. We go out to the farm, we see what the need is, and then we work with the teams there. Absolutely. But it's more, I would say it's more public health, reaching out to their supports, which is Finger Lakes Community Health, to serve this population, which is great.
Any more questions that we do have time? Oh, there's another one. Does your local DHHS department transport your patients?
We have a medical transport service for those who qualify, but I'll be honest to say that a lot of our agriculture and farm workers do not qualify, so they wouldn't be able to utilize that service. So that's pretty much Finger Lakes Community Health, assisting in those transportation.
We do have time for more questions, but I would like to direct you to say that if you haven't done your survey, can you please go ahead and do your survey. The link has been provided. We really appreciate that for your information.
So one question.
Yes.
You mentioned about your outreach efforts. You never stopped conducting outreach?
We did not, no. We
Okay.
doing outreach even when they didn't want us to do outreach. And what it changed, right? So it had to evolve. My team did outreach over the phone. They did outreach, via our blasts. And then we have feet on the ground that would go and they would drop off, information packets, masks, and they would just put it on the porch. They would put it at the front door. They would give it to the farm owners to say, here, I know you have X amount of people here. Here's the information that they need. Please have them call, La Clínica. Please give them our number, our direct line if they have any needs. So they never stopped. They never stopped going out. They never stopped calling. They never stopped engaging.
Wow. That's awesome.
It was similar for us. We had a group of community volunteers that would do no contact drops, food, mask, hand sanitizer, and printed information. And it was really critical because we would get lots of requests from farm workers saying they don't have masks. And I would say it included everybody from kind of retired people to vets. It was actually very reassuring when the community volunteers, we would meet in a parking lot, load up their car with whatever, give them the address they were going to, and off they would go.
Like in your case, but in your case, like you were saying, even you guys were still doing outreach, even though they didn't want you to do outreach. When you say that, what exactly are you referring to? Because in our case, I know that our staff, they were not, they were instructed that they were not able to do that. They were not able to do outreach.
So
anymore.
Sure. So when I say that they didn't want us to, I mean the farm owners didn't want us on their property.
Oh, the farm owners. Uh-huh.
Yeah, and engaging with the farm workers.
What about your clinic and your as far as your policy and procedure for that?
No, we as an organization made a commitment to continue doing our outreach. That was from our CEO, and everybody had a commitment to that. And we just
that's great.
What we needed to do was make sure everybody was safe. That the safety priority. My team was equipped with masks, with face shields. I mean, they were equipped to the nine, but they still had the ability to go out and get information out because it was just a scary time. And a lot of people stopped going out. So we have great programs in the region that do work with some of our population, but they all stopped. And, we talked about that. And our CEO's commitment was, we don't stop going. Let's just keep our team safe.
Wow.
And that was a really interesting thing because as Yissette said, there were colleagues who just stopped. And so it was really interesting to see how we had volunteers all over the state and would drop off those materials all over the state. And so it was kind of a defining moment in terms of who was going to continue to carefully, safely support the farm worker population as essential workers because they never stopped. And that's the critical piece. Farm workers never stopped working. And so what are the kinds of supports that they needed throughout the pandemic?
We also have another question. Do you go out with your dental team for outreach?
We do. We've kind of stopped that portion of it, the dental component of it since COVID, but yes, we do. And we're planning on bringing that back up. So we have a dental provider that goes out and with our mobile medical program is what we call it. And they do screenings as well.
And Eva, can you share your email?
Yeah, sure.
I'll go back to that.
Please.
Screen share.
Thank you. Can we have a few more minutes if anybody else would like to ask another question?
Is the screen up, Yvonne?
Yes, we can see it. Are your dental and medical service costs the same?
So they're on a sliding fee. So it's based on eligibility. So we just, we register our patients, our clients, and we go through the process to see what they're eligible for. We do not turn anybody away for inability to pay or whether they're insured or uninsured. So we have the ability to still provide those services.
Okay. Don't see any more questions coming in. Anybody else out there that What's your cost for agricultural workers to receive services?
So it's the same response. It really depends on individual and their ability to pay. So we screen them and see what they're able to do. And if the answer is nothing, then they get charged nothing, right? So it really is a screening process that they undergo, a quick one. And my team is really good at being able to kind of walk them through that and then go from there.
Has your dental team used fluoride varnish and silver Damian fluoride, both cheap and can be given to adults? What's about your vision screening?
Yes, we have. And our chief dental officer is a huge proponent of that. So yes, we are using that in our health centers. We have a community or a school-based program that we work with as well very closely. And that's what we do because it's cheap and it allows us to potentially save a tooth and then come back later if we need to. So absolutely.
And then how many medical buses go out at once to camps?
So we've had 2 to 3 teams go out at one time. Right now we're trying to, we're doing bigger efforts. So usually I have maybe 1 to 2 at a time doing, either the testing, once we do vaccination, my hope is that we could do, bigger events. So I'll say in one event, we may have 5 community health workers, 3 providers and do, vaccination for 200 people. That's not unheard of for us, or we could do something smaller. So it really depends on what the need is. And then we kind of plan it around the schedule for the team.
Okay, so this will be our last question. And it's how many staff do you have in each of your clinics serving migrant workers?
All of our staff serve migrant workers. So the answer is everybody at the organization has a commitment to migrant workers. In particular, our community health workers, we have about, I want to say about 7 that are tied to the outreach effort, but it's an organization-wide initiative. So when we say commitment to migrant workers, it's the whole organization from the moment they cross the threshold and even as we go out to mobile health center or to the mobile clinic.
Okay, well, I think that's it. We've reached our time. But thank you again, Mary Jo and Yissette, for your presentations. And thank you everybody else who was here for the session. Again, please do your survey so we can get your feedback and input, and have a wonderful day.
Thank you all.
Thank you so much.
Thank you, everybody.